A very warm welcome to all of you who have joined us on this nice Sunday afternoon. I am Melissa, your host for today's event. I am excited to introduce our third talk in this online rehab health talk series on fall prevention in elderly. For those who are new to this online talk series, it is a collaboration between Malaysia Network of Caring Communities and the ReGen Rehabilitation Hospital. This is part of the ReGen Rehabilitation Hospital's Corporate Social Responsibility Initiative, aiming to help the communities in gaining back their functions. We already had Prof. Dr. Lydia spoken to us about the issues around rehabilitation for bedridden elderly in our first episode, and Mr. Amin spoken to us about mobility issues in elderly in our second episode. They are now available on our MNCC website for viewing in recorded and ebook version. As you can see, there are the other important topics surrounding our beloved elderly in the upcoming months. Today's program consists of a 5 minutes introduction and orientation, a 40 minutes talk, then followed by questions and answer session. The talk will be conducted in English language. During the meeting, please keep your microphone muted at all times. Keep your video camera off to ensure more stable internet connection. The session will be recorded. Your participation in this meeting implies your consent for the recording. Please type your questions in the chat box on Zoom or on Facebook live comment box. Alternatively, please use the raise hand button in the reaction tab, then unmute your microphone to ask questions directly to the speaker when the host asks you to do so. We will answer your questions during the Q&A session after the talk. Here, I would like to make a disclaimer. MNCC Health Talks aim to raise public awareness and promote healthy living. Information provided today is not to replace a doctor's consultation. If you encounter any personal health problems, please do not disclose it here to protect your confidentiality, but consult your personal doctor. Now, let's introduce our speaker for today. Ms. Cheah graduated with Bachelor of Science in Nursing Practice Development. She is the nurse educator of ReGen Rehab Hospital. Without further ado, let us welcome Ms. Cheah.
Hi, good afternoon, everyone. My name is Cheah, represent from ReGen Rehab Hospital as a nurse educator here. So we'll be giving a talk like prevention of fall, keeping a safe environment. So I will start to share my screen. All right, so we will start our topic today. So again, good afternoon to everyone. So the topic here reinforced again, so prevention of fall, keeping a safe environment. So then our fall is preventable. So for me, I would say a yes. So fall are largely preventable. So then for the today's sections, so we were trying to talk to regarding definition of the fall, fear of falling, risk factors for fall, action steps to reduce the risk of fall. So then the other, what is fall? So according to Rubinson's 1986, an individual comes to rest on the ground or other lower level with the without loss of consciousness. So that is including the sleep, the trips, that imbalance, that we will consider as a fall. So then have you had a fall? So then you may ask your elderly or your family member, do you have a fall past year? Did you tell your family member when you had a fall, or your elderly, your grandparents, your parents, did they tell you where you hurt? So do you worry about falling? Do you feel unsteady when you are standing and you are walking? So have you previously fall increased your future in your fall risk, and where is the location that you mostly will be scared of fall, or you mostly will be fall over that area. So does the fall limit your activity? So fear of falling. So a lot of people, after they have a fall, they will stop doing their activity, although they still can perform. So because of the previous history, they're causing them, if I walk a lot or in their mobility a lot in the house or in the outside, then they say, I will have a fall. So then they were very fears of falling. So then they are keeping themselves sitting on the sofa, keeping themselves lying down on the bed without doing so much of activity. So then this is one part of it, the fear of falling increase in the future fall as well. So then why does this fall fears is of the feeling method? So when you have the fears is happen to you, you may stop from doing some activity. So actually you can do so, but then you stop it. So you say, I try to minimize it so I can minimize the fall. So then because of this inactivity happen to you, it will causing your muscle weakness. So you feel your leg is weakened. So then due to all these activities reduced already, so it can lead you to a fall. And then because you are lying down on the bed, on the sofa, if there's somebody, your family member invite you to go out or you go to the garden, have a small walk, then you say you don't want this one in the house. So then you might feel the person will be feel alone. So in the longer of time, it will causing you some depression also, because they are isolate themselves in their house, so that they are feel very depressions about this. So then what kind of type of fall the risk factor? So there is fall. So then there is psychological effect, prolonged hospital stay, loss of independence, and secondary complication. Okay, so physically, psychologically effect, even a fall with no physical injury also can be lead to worry and distress for the patient and their family or the staff. So there is a history of one of the person is had a fall already. So sometimes patient themselves or the person themselves, they will say, okay, I had a fall before, so I have to stop certain activity. So I don't want to go for a walk, even though there is no injury, no nothing. So, but then because of these fears, they're causing them to stop, or their family member. So some of their family member, they are worried they are elderly to fall again, so they will stop them to doing some certain activity. Like some elderly, they are very active, they like to cooking. So then they will stop them. You don't go to cook anymore, so you are just sitting down here. I will do it for you. So then it also will be effect on that. Even though in the hospital, sometimes there is some elderly had a fall already. So some hospital, to prevent the fall again, they will just stop the patient to doing some activity in the hospital, like stopping them to go to the bathroom, to have a shower, to have their bowel open and urination. So they were keeping them on the bed, helping them. Okay. And then because some of the fall is happened, they need to be admitted to the hospital. So then they're supposed to be admitted to about 2-3 days, just a fever. So then in case there is a fall, there will be have some pain, some discomfort, and even some minor injury. It can be delay the recovery for the elderly and also extend their length of stay in the hospital. So there is some major fall that will be happen, some limb fracture or anything. So the patient need to be lying down on the bed, undergo some surgery, undergo some conservative treatment. So the patient will be effect on their ability to maintain and regain back their independence level. So then these are things also will be affected on them. So secondary complication, we have some elderly, there will be like osteoporosis patient. For elder people, they will be happen. So then there will be have even more injury, severe injury like pelvic fracture. Then their mobility level will be reduced a lot, and there will be also will be bringing them to another secondary, other than fracture, they were giving them another some illness like pneumonia, thrombosis, and then their pressure ulcer if they're lying down long term on the bed, and then some DVT, some blood clot in the lower limb there. So it's also will giving them some secondary complication other than the fracture. Okay, so then what can you do to prevent, what are the risk factors? So these are the things that causing the patient had the fall. So minimizing the fall depends on the individual. Identify those most risk of falling and coordinate appropriate intervention. So the risk factor are most significant due to some patients that have dementia and then Alzheimer. So they will have some confusions, some agitation. So then they will be confused day and night. So then they are feeling like they are still very okay. So then they were just trying to walk to toilet, but some other factor causing them had a fall. Or some patient they will need to take some sedation at night, so for sleeping tablet. So after they take already, they feel a bit of drowsy, so then they're trying to walk. So this are also causing them to have a fall. Alcohol, and then the patient has a previous fall. Physical health issue also because of some stroke or some fracture or some lower limb got some problem. So and then also is the environment. So and the other thing is like incontinence. So patient is can't control their urine very well. So they were needed to go to toilet quite frequent, like hourly, 2 hourly, but it's just a small amount of the urine. And then also is due to the physical inactivity, muscle weakness, and their walking is quite unsteady. So these are the things that will be causing them to have a fall. So what are the things that you can change and what are the things you can't change? So then the risk factor, that the things that you can change is your physical inactivity. So your home environments, your visions, medication, fears of falling, social isolation, weakness, improper use of assistive device. All these things I will describe further in the next slide. And the things that you can't change will be your age, your gender, and your ethnic background. So these are the things that we know already we can't change. So we can change the things that is in our activity, our environments, our visions, and our medication. So in the hospital, normally nurses will do a 4 assessment first. So then we have 4 assessment, then we will have a rapid method to assessing the patient, whether they have a likelihood of falling or they are the most contributing factor that is effect on them. So then these are the location of core assessment that every patient come to us, we have to be assessing them. So before we identify the risk factor for the patient. So these are the factors that we will be assessing, like the patient has experience, what are the medication they are taking. So the medication, we will go into it and see whether there is some medication that cause the patient drowsy, will cause the patient vomiting or anything, then we will check into it, and then their medical history and their sensory communication and their physical health. So from this level already, so we can identify a score for a patient. And then for once the patient, we already identify the needs already, so that we will implement all our care to a patient and we will modify it. So our care according to the patient. So for example, is for community, also a care plan should be focused and the sign of posting relevant internal and external service to supplying service, the usual and carer. So information leaflet also sometimes we will given to the patient also when they are go back to the house. We will together work as a team to giving some education to the patients. So then after we already talked about what are the risk factors, then what are the things that we can prevent the fall? So then part of it is the first thing, promote in our ReGen Rehab Hospital is exercise. Exercise actually can improve your balance and your strength. So then you can have your doctors, you can have your pharmacist to review a medication. So to check on this medication, and then you also can have a vision check and make your home saver. So then these are the things that we will elaborate more. So then first one, as I said, exercise. Exercise is quite recommendation to every elderly patient and also non-elderly also, and we are adult. So when the elderly want to start the exercise, normally we will have to consult the doctor first, because what are the things that they can do, what are the things they cannot do, and then we need to know whether they have an underlying disease like certain heart problem. Then we have to know how much exercise we can plan for the patient. So what are the ability they can do until which level, but we don't want them to stop exercise. So then normally the PT, the physiotherapy staff, they will have some begin assessment, then they will plan what are the exercises suitable for all the patients regarding their underlying disease. So they will also giving some pro-prevention classes to them and teaching them what are the things they need to do. So then to be sure that all your level is ability that you can perform and is suit to you. Also, you can go for certain classes is suit to your age and your group and the ability that you can do. So all these exercise, you must stick with it. So continue your exercise, gain your strengthening, gain your strength, so you can work even more further. Okay, so then second part will be your environment recommendation. So identify and eliminate the fall hazard in your home and your community. Our occupational therapists, physiotherapists, and the nurses also can be helped to identify the safety issue and give some solution to you all so that you all can keep yourself environment in safe. So these are the example, like the toilet, you must have your grab bar, so you must have some chair for you. So easier for the elderly when they want to getting up from the, after they pass urine or anything, so they have something for them to grab and stand up steadily. Because majority of the fall for elderly is mostly happen in the toilet. So these are the non-slippery floor mats, also to prevent them because of too much water or some soap there that can causing them that when they want to walk, so then unsteady they have the fall. So the bed, sometimes you can modify some back rail over there so they can hold on when they are trying to sit up. So to prevent them also have a fall there. So these are some home tips, safety tips that to prevent some fall risk over here. Okay, so from here you can see from this picture, this is patient bed. So from a picture here, there is some too many of the things that is not useful we are placing over here. And then there is a floor mat, some shoe is placing over here. So when the patient trying to get up, then they will have a slippery, then they have a fall. And then these are things that are not needed. And some furniture that is blocking their way when they want to move out from here. Okay, so the safer way, we will put some table lamp. So for them to have enough of the light for them to have a view. So you can organize all the things here. That means the floor mats, you remove it. The shoe you place underneath here so that there won't be stuck here and then there's trip here and then had a fall. Okay, and then you can put some bell here. Example like ring, also you can put some phone here so that easier for her to call for help. So then accessible for them, so easier for them to reach the area so they can call for certain help when they are needed. So then you remove the furniture here already, clear the pathway for them to walk out from the room. So then the other second way, if the patient needed some assistive device. So the assistive device is used for some elderly. So same also, here we have the wall plug, so you can put some lamp here to have enough light to the whole room here. And then some assistive device too far away from the patient bed. And then you can see the bed sheet over here, or is tangled down to the floor already. This also will be the cause of the fall. So if modified one to be a better one, you can put a small lamp here so that enough brighter to the room so that their visual can be see the environment clearly. So the assistive device have to place near to them so that when they are seated up, so they can get it easily instead of they have to walk to here to get it. There is a risk for them to walking here. They also might have the risk of fall. So it's part near to them is a safer way for them. So, and then keep all the bed sheet not tangled on the floor. So then the third one will be some in the staircase. So there are some, their houses nowadays, we have a lot second level already. So they need to walk down from the staircase also to prevent them to have the fall. So the number one here, you can see here without the handrail. And then too many things here to obstruct the staircase there. So obstacle too much to be blocking the way, and then no enough light to brighten the area over here. So we'll be leading them to have some trip and misstep also. So the modified way, we will have to have a put a handrail for them, so they can holding here slowly, steady to go down from the staircase. And then the second one, we remove all the obstacle here, so clear the pathway, easier for them to walk. So then the third one, you have enough the light over here, so that it's bright enough for them to see the step. Okay. So the number 4 one will be your living room. So then for the living room, you can see here, number 1, again, the floor mat here. So it also will be causing some trip and the fall. And then you can see here, there is some wire cord over here also. It also can cause the trip also for the patient or the elderly, either anyone will do, because when we want to walk to there, without seeing this, then we will have a trip and have a fall. So, and then too many things to be obstacle blocking the way, the walk to the toilet, walk to the sofa there. So then to be a better way, organize your thing well, so you can park it to one side, and then you remove your floor mats, make it to be clear, and then the wire cord, you can park it near to the wall here. So easier to have a clear pathway over the living room here. So then this is the bathroom. So number 1, you can see here, no grab bar over here, then not enough the light, and then you have some floor mats. So some elderly, they will be easily slip and fall. So without anything assistive device or equipment to be placement here. So to be the better version, we will be encouraged to have a grab bar here, so that for them to hold on, and then enough light for them. Remove the floor mat, or you want to put the non-slippery one also can. And then we will put in some chair here for the elderly to sit here and have their bathroom, have their bath here, so they can safely without standing here too long. And then the last one will be the kitchen. So some elderly, they like to cook, so then we cannot stop them to cook. So then we have to modify our kitchen environment to be suitable for them. So there is a lot of things they will be placing so high up over here. So they need to use something like chair or any other things to climb up here to get all the things here. When they're trying to get up here, so then they are easily to get a fall, because not sure whether they will be like giddy, not sure whether it's the thing that the stood there is not stable and unbalanced, they have a fall. And then also had the floor mats here, so causing the fall also. Some of them, they will have some pads, so they will have the pads dishes that placing over here, also can cause some trip. So the modified version, we will just place the thing organized. The needed to be used one, we were trying to put downstairs here, and very rare to be used on, and not often to be used one, we will put over the top one. Often to be used one lower or here. Okay. So number 2, the floor mats, we will get to remove it, and then some pets dishes also we place another place. We either can place outside of the house, so easier to clear the pathway for them to have their safe environment in their cooking area. So this also as part of some example for the toilets. You can see here is so messy. The shoe is here, the locker is not locked properly, and then the towel is here, and then the floor mats also is here. So it tends to get easily to get them to have a fall. So like example, they will put in some grab bar over here, close properly, make sure the whole thing, the floor here organized nicely and tidy up, and then some assistive device also is putting here for them to shower. So these are the living hall also, is quite unorganized with the newspaper, with the glasses, so with the cup here and the wire, and then the cloth is dragging here, and the newspaper is everywhere. So it also will be causing them to have a fall. So organize it nicely, newspaper place one side, then all the wire to remove it to one side, organize the table, all the cloth is putting properly, so that to have enough pathway for them to enjoy their life in their living hall, enjoy their TV or reading their newspaper. Okay. So then the other thing would be like, come to second one, would be the third one would be the medication. So some medication will have some side effects that will be causing you some dizziness. So some medication changes also can be increase the fall risk also. So try to get used to go to one pharmacist that you are usual to go. So, and also to have your annual medication review. So make sure all your medication is you consult with your doctor. Don't buy over your counter by your own self lah. So the doctor will telling you what are the things that causing you to have giddiness, what are the medication you have to take precaution. Even the pharmacies also can be informed to you all what are the things that you have to be extra precautions that after you're taking you will cause some dizziness and drowsiness on you. So be sure you can read the label before you consume all the medication. So then the other one will be your vision. So part of it, a lot of elderly, they will have some vision problems. So they are feeling like the vision is not so clear, causing them they have some blur of visions. So common things will be like cataract. Some other elderly patient also will have the problem like glaucoma. Glaucoma is a common vision loss in the elderly patient. So causing them an individual, their peripheral vision loss at the greater risk of fall because their peripheral way is cannot see very clearly. They only can see the narrow at one side only. So then it's also can causing them to have a fall. So have an annual checkup to check your eyes visions. So make sure the lens that you are reading once multifocal lens may blur or distort your vision looking down. So you can use a separate reading glasses. The reading glasses, you can use one spectacles, and then for ambulation one, you can use another one, short-sighted or long-sighted one. Okay, all right. And then the other one will be like blood pressure and checking. So certain elderly, when they are sitting up on the chair or lying down on the bed, when they are trying to standing up that time, their pressure sometimes usually will be lower a little bit compared when they are lying down. So then when they are standing up that time, then they will feel a bit of dizziness happen or giddy happen to them already. So regular check up your pressure. When you're having some problem when you're sitting and standing, you have some dizziness. So please go and check with the doctor to see whether you have some, we are calling that postural PP that is causing you different position have different of the blood pressure. So when you are changing in position may cause you have changes in the blood pressure and also will causing you have some of the giddiness. These are the things is quite major to lead you to have a fall. Okay, so if you have this, it's better to go for the check with the doctor. Some blood pressure medication also will increase the fall risk. So you have to speak to your doctor. So be careful when you started the new medication. Normally when the doctor started the new blood pressure medication for you all, so then they will have to speak to you. You have to monitor your pressure regularly every day so that they just want to see the effectiveness of the medication. So then beginning of the stage, doctor will closely monitoring of you and your appointment to seeing back to them is quite close. They won't give you about 1 month, 2 months appointment. Maybe they will give you another 2 weeks, then they will review you again whether the medication is suitable or not. Okay, then the other one will be your urinary incontinence. So then quite a major issue for the elderly, they will have to go to toilet quite regular. So we will do some breather training. So we have some time waiting for them. So we will encourage the elderly, don't wait until there is very urgency need to go to toilet, they only go to toilet. So that we will encourage them to go to toilet, empty every 3 to 4 hours. So they can no need to wait until they are very urged, they only they rush to the toilet. So they can go and void every 3 hours or 4 hours. So then easier for them, no need to be running to toilet without anybody to help them. And also we were teaching them to do some pelvic floor muscle exercise 3 to 4 times per week. So and decreasing the late afternoon or evening fluid intake. So toward to the after their dinner, about 8 o'clock, 9 o'clock, we trying to advise them, minimize their water intake. So to avoid them to waking up at the night for urination. So to keep them as safer. Okay. So then the other chronic condition also may cause the fall risk. Chronic condition may contribute your fall risk also like diabetes, arthritis, stroke, neurological disorder like multiple sclerosis or Parkinson, chronic pain, depressions, chronic obstruction pulmonary disease, and sleep disorder. All these are the factors that is causing the person to have a risk of fall. So risk of fall may increase because you are changing in your medication, you have your illness or your infections, you have your pain, you're not enough sleeping, you feel worried or you feel sad, and then you feel you are reducing in your activity level, and you are changing your assistive device. So you are from walking frame, you change to the cane, or you from a walker, you change to a without anything to help you, or you move to another new environment or new house. So because you are not used to the environment, that is causing you also had a fall. Okay, so then start with a small step. So then ask your doctor or physicians, pharmacist to review a medication and to be aware of the side effect of the medication, which may cause you to have a fall. Consult your occupational therapist. Occupational therapists can do some home assessment and recommendation to make your home to be safer. Physiotherapist, so it will help you in your physical activity, balance, and your strength, and to make sure you are moving safely. Okay, these are things that you can consult with them. So address any of the factors to them. They will give you some advice. Okay, example, if you have a fall occur, okay, so you need to check for injury, call for help. So seek for medical attention, whether you have got injury or non-injury. So better to have a check. So you might have to hit your heads or anywhere, maybe you are not aware. So check for the safety hazard. And then after this, learn how to get up safely from your physical therapist. So don't fear for the falls. So get some physiotherapists to gain your strengthening so that you can stand up again. So then lastly, rehabilitation actually can be helping you in post fall or prevent fall. Adequate rehabilitation in physical, socially, and psychologically of an injury person is very important post fall, and also can be said is prevention of the fall. Okay, then that's all from me. This is our hospital setting and environment. These are the way of the equipment they will use to helping everyone to doing their physiotherapies and occupational therapies to gain their strength, to gain their level of balancing. Okay, this is my reference. So thank you. This from ReGen Rehab Hospital.
So thank you, Ms. Cheah, for the very informative talk just now. So now is for our time for Q&A session. So dear participants, if you have any questions, feel free to unmute yourself and you can ask our speaker directly. So I think, Ms. Cheah, we have a question here. So if the elderly has a fall at home, what would you advise the family member to do? Should they help them to get off the floor?
Yeah, if they found the elderly fall in the house, so first thing they must be make sure the safer place. So then they have to transfer them safely. So some of us will be like panic ready. So we will just move whatever that we will move. So first thing we have to check where are the injury first. So careful carry the injury part. So then slowly move them on the bed. So then if the elderly still can move, then they can use their own transport to send them to the hospital to have a checkup. If the elderly say it's a very severe pain, they can't move at all. So then I will be advised you can put some blanket over the floor. If they are in the toilet, we definitely need to move them out. If they are in the living hall or the bedside, we can put some blanket underneath the patient first. So we can call the ambulance to get the ambulance help to send them to the hospital. Because we worry about fracture, then if they're moving a lot to the patient, it will causing even more severe injury to them. But we have to check with the location, like kitchen, toilets, all these things, we still need to safer remove the patient from that area. If let's say living hall, or in the bedside, so we still can place the blanket underneath there. If the patient say it can't move at all, the elderly say cannot move and they can't do it.
Okay, I see. Thank you, Ms. Cheah, for the explanation. So yeah, our participants now, they have some burning questions as well. So I think we will move on to the next question. So the next question is, for fall assessment, what does sensory communication refer to?
Sensory communication, we were checking for about whether they can communicate to us well, and we also will be checking their sensory, their body part sensory, whether they can feel it clearly, or we were checking all the head to toe from their cognitive level, how they communicate to us, are they short memory, and then these two things we already checked. Then we were checking on their sensory of the body. So when we were touching them, they would be like have the same sensation of the from the upper limb and the lower limb sensation are the same or not. If not same, then we will tell them your sensory over the lower limb a bit of a desensitivity. So you have to be extra careful when you're waking up from the bed or anything. Is it answering? Can hear me? Okay, I can't hear you.
Okay. Hi, Ms. Cheah. Yes, thank you for answering the question.
So this is the second one. What are the signs to look for when the person should no longer be living alone? So when there is a sign that's a person who are not allowed to be living alone, so what we are practicing in our ReGen Rehab Hospital, we will advise to the family member. So they need a carer to be stay with them. So we will advise them they are no longer to be safe to be alone. Example like patients who are Alzheimer, dementia, they are definitely are not safe to be alone. So we were teaching them how to have some carer training, to train their carer how to safely transfer the patient and how they have to monitor the patient without stopping them to doing some activity. Some, let's say the carer is the daughter or the son, so they will be worried about them to have a fall. So they were stopping them to doing some activity. So we were giving them a clue how you schedule your roster, like example, a roster in the house, to telling them how to perform the task to this elderly patient, elderly person. So then we were telling them what are the things you can do in the morning, and then how you have to assist them. So certain patients, they still can move around. So we will still encourage them to move, but they still need some other people to be like supervising them and keep an eye on you. So this is the answer from me.
Okay, thank you, Ms. Cheah. So we'll be moving on to the next question. So for question 3, how many falls in a year is normal for an elderly? If they have a lot of falls in a year, what should we do?
So how many years of fall in a year is normal? Actually, we will try to minimize there is no fall at all for an elderly patient. Yeah, we do believe is like certain elderly, they have a lot of fall. So like previously, we have also like certain patient before admitted to our hospital, we will have some regular interview to them. So how they had a fall. So they would tell us like at least 7 times in a year, which is they are not focused on it. They thought it's a normal trip like that, but they don't know that these are the things that causing them imbalance already. So then we are telling them this is a high alert to you already. So when you had a fall so frequent in the per year already, so then why not you just go and have a checkup? So you check what is the problem that having to you is due to muscle weakness or other things that causing you to have a fall. So advisable no fall at all for elderly, because had a fall for them is quite a huge impact for them to have some they have some fears, they don't want to move, all these things. So the best thing, check up, and they can found out already their problem. So to get some expertise like physiotherapists to gain their strengthening. If they have some heart problem or anything that causing them all these issue, giddiness, so to have a right treatment to be done before they get some other things to be happen to them.
Yeah, I see. So I think the important point is to have medical checkup here to seek for help when needed. Yeah. Okay. So thank you for answering that, Ms. Cheah. Let's move on to the next question. So we have question 4. If an elderly has a first fall, should we limit them? For example, avoiding using the staircases?
For the first fall, okay. So how we should limit that or not? So for me, normally I will not limit them. So as usual, again, I will have a medical checkup. So we will try and see whether this fall is causing by other factor or not. It's due to giddiness, unbalanced, unsteady, or is their misstep. So then we also have to encourage them again to use the staircase. Like some people, they are staying in the department without a lift. So they are still needed to use the staircase to walk upstairs. So these are the things that cannot be avoided. So we have to check properly for them. So what are the causes to cause them to have this fall? So if for the person without injury, after doctor check also is no injury, they are say it's due to misstep or unsteady, yes, we will still continue to encourage the patient to use the staircase. But maybe first few times we will with them, subsequent we have to remind them with the handrail at the side staircase, their side, as I previous slide I had explained before, enough light, remove all the obstacles, so clear the pathway, easier for them to move up. So then these are things we can still encourage. If the person say it's due to giddiness, it's due to other things that they had a fall over there, so then these are things that we have to do some treatment. And for time being, we will stop them to using staircase for a while. So then until all the medically stable, then only we will move on to another step again for them.
So I have a follow-up question on top of question 4. So let's say, what if after a fall, the elderly, they refuse to be physically active? So what should we do in that situation?
Yes, actually got a lot of elderly after they had a fall, they will definitely say stop. The moment you want to carry them from the bed to the chair, from the bed and sitting at the bedside also, they were telling you, I don't want. I have very fears of the fall already. So then we will be encourage them. So these are the time is quite tough for us because we have to keep encouraging them. So then by this way, we have to keep like showing them an example. So we will always be beside them. So we won't leave them alone. So give them an encourage. Beginning of the part is quite hard. Maybe 1-2 times you will still feel. So then you can do some passive exercise in the bed. So calling them to be like exercise in the bed first until we will tell them, do you feel some strength in your leg? So then only we slowly to move on the patient to the chair. So we will move by a short distance first, like from the bed to the chair and from the chair to the bed until they gain their confidence ready. Then only we will slowly to move on even further. So from the bed to the bathroom and then from the bathroom to the bed again. So even they are even increasing their confidence level. So then that's the way we were trying to walk the patient around the corridor already. So these are the way that we are doing for the elderly. So to gain their confidence again, so we have to take a quite long time for them and telling them we never leave them alone. So at the same time also we are holding on patient, so they know we are holding with them, so they won't feel alone. So part of it, their fears because of they are alone walking. So then they say, if I walk alone, my leg will be weakened and they will stiff and they will like just step down on the floor.
Yeah, so I think this is a very useful tips for us. So next time if we have the same situation in our home, so definitely we can use this tip and try out to help our elderly in our home. Yeah, thank you, Ms. Cheah. So I think that's all for our Q&A session. Thank you very much, Ms. Cheah. So, dear participants, thank you for staying with us. It's already near to the end of our event today. So again, we thank you, Ms. Cheah, for being here. And I believe that today all these tips are beneficial to everyone as well. So for your information, all the recording and electronic book of this talk will be made available at the MNCC website in 1 to 2 weeks' time. Feel free to check them out or share it with your friends and family, as well as because all the materials are free of charge. So for those who are interested in following our future MNCC talks and the online Rehab Health Talk series, please kindly click like and follow our MNCC Facebook page. We will frequently update the dates of the future talks on the website in the near future. Also, please, can I ask for your kindness in scanning the QR code here to fill in a feedback form to let us know how we can improve our talks in the future. Your feedback means a lot to us. So thank you for attending and hope to see you all again. That's all for our talk today. Thank you.
Thank you, Dr. Melissa.
You are welcome, Ms. Cheah.